My name is Janet Benson, and Cheryl is my daughter. And we are appealing to the public for help so that Cheryl gets honest neurological and medical care for repeated brain and body damage that is very complicated and has been left with no treatment that is given to Canadians and is her right. Cheryl was diagnosed with chronic fatigue syndrome and fibromyalgia in 1991 and has suffered tremendously from it. Her functioning levels greatly reduced and mostly bed and house confined. In 1994, she was diagnosed with hepatitis C and her chronic fatigue syndrome diagnosed as well. She belongs to a subgroup of CFS survivors that are dose sensitive to antidepressants and had years of serious adverse drug reactions that are repeatedly ignored and misdiagnosed and psychiatric put on her files, her medical files, and kept on these files so no one would help her. In 2003, she was misdiagnosed as bipolar, and trial medications were given that caused serious brain damage. Every muscle in her body and ligament in her body, her speech and cognitive abilities greatly affected as well. She was given more medication saying it would mitigate the damage, but started severe convulsions and seizures that lasted for weeks and damaged her muscles more. This is when Cheryl started being abused in the hospitals, keeping the damage as psychiatric or non-existent on her medical records. Cheryl continued the bipolar medications for 3 months, but was put on medications that did more damage. In 2004, Cheryl came off the remainder of the medications once she had been on for 12 years, affecting her speech again and weakening the left side of her face and making her body drag around, off and on, and non-stop seizures and convulsions, daily for months. She still has convulsions almost daily and seizures as well. She was refused admission to the neurological hospital in Toronto, where she should have been admitted with her first brain injury, as well as the others that followed, and extensive diagnosis, treatment, care, and recovery refused that is afforded others with acquired brain injury. Her medical records are badly falsified to cover for the extensive damage. We have been unable to obtain most of them so far, with 6 hospitals involved as well as numerous doctors. The cost would be extensive. We have gone everywhere for help, medical associations and all political avenues, repeatedly, to be stonewalled at every turn. So we are asking you to please ensure that Cheryl gets the honest neurological and medical care she so badly needs as soon as possible. Her convulsions and seizures stabilized, and that she is hospitalized for as much diagnosis, treatment, and care at a pace she can handle. Her low functioning levels have been used against her so that she would have to go back and forth for numerous appointments that she could not or would not have been able to do even prior to the repeated brain damage. This has been allowed to continue for so long, with so much extensive damage, suffering, and abuse in the hospital she has endured, is an outrage and a testament to her courage and will to live an autonomous life as possible. The Ontario government has proven so far that it is not capable of supporting my daughter's human rights. Please sign any petitions or send letters on our behalf. All prayers are greatly appreciated. Ultimately, we strongly feel that Cheryl's best chance for honest testing and diagnosis is sponsorship for neurological treatment and a care facility that is on the leading edge of her illnesses and extensive neurological damage outside of Canada. If you can help with donations for legal fees, obtaining her medical records, care for Cheryl, sponsorship for Neurological Hospital, a trust fund has been set up at the Toronto Dominion Bank for anyone who can sponsor my daughter fully. It can be arranged at the hospital, where she hopefully will be admitted. A nurse or caregiver has to be in attendance with Cheryl. More details are at the end of this video, and you can also reach us at publicappealforcheryl@gmail.com. There have been years of extreme, unneeded suffering for my daughter. Watching my only child suffer needlessly and not be able to get her the help she should be afforded by Canadian law is heartbreaking. Please come to our aid. Thank you, and God bless.